When you look at the other countries on that list, they're countries that have been torn apart by war or civil unrest, and they certainly aren't rich countries with good public health systems. And so to find ourselves there is humbling.
Welcome back to Closer Look across the Village Media Network with Michael Friscolanti. I'm Scott Sexsmith. Okay, last night we made you smart about money. Tonight we're going to make you smart about your health. And for David Chilton's sake, who I'm sure is watching, we do have a door. We both can't get through it at the same time, but we do have a door.
Yeah, for the record, we left last night and came back today.
Single file.
We actually went home, left the room, and now we're back all in single file. It is fun. We should get a clip of Derek closing the door because it's quite the process.
It really is.
It's a heavy door, and it's.
We need like a camera that we can shoot that way so that people see.
It does feel like you're
the magic.
Once you close it, you're never getting out. It does feel.
And there are times we don't want to get out.
It does feel that. Speaking of getting out, the segues are. They're on a roll with segues.
It's crazy.
Canada has been booted out of the club of countries that are free of measles.
Yes.
They've lost their official measles.
Is it 27 years?
27 years since 1998. They've been considered a country that's measles free. The correct term is measles elimination status.
Right.
And it's given and taken by the Pan American Health Organization, which is part of the World Health Organization. Basically, to make a long story short, we've seen headlines in the last year about measles outbreaks, especially in Ontario and Alberta.
Right.
It has spread in ways we couldn't have imagined 20 years ago. We eradicated measles a long time ago. And now it's kind of been back with a vengeance. We've talked about this on the show in the past. And officially, Canada, it doesn't change anything. There's the same amount of measles cases today as yesterday, but we're officially a country that's not considered to have measles under control, which is pretty sad.
It really is.
It is kind of sad. I don't want to, be a doomsdayer, but there's enough bad news going around, and you're worried about things in the world, and now you're thinking, man, we can't even take care of measles.
You wouldn't have had this on your bingo card.
No, we had that. Yeah, we had that figured out years ago.
Yeah.
So we're going to kind of talk about what it means because it obviously is in the headlines. It's all over the news. We're going to talk about what it means practically, how we got here, because people have some assumptions of how we got here, but there's a lot of reasons why we're here, and sort of how we can get out of this and get back to a state where we were for many, many years. So we're going to speak to Dawn Bowdish. She's an immunologist at McMaster University, a friend of the show, as we called her.
From the Hammer.
From the Hammer. She was on our original podcast, Inside the Village, and was hugely helpful at that time talking about COVID vaccines.
Yes.
Very, very knowledgeable, and she can really explain things in a way that most people are not doctors. They're not immunologists. And so for her to explain in the way she can do it very well. So we've invited her to come on. Very kind of her because I emailed her this morning and she said, sure, I'll be delighted to. So it was all very short notice, but we're very appreciative that she's come on to talk to us. And I think people are really going to get a lot out of this conversation.
On Monday, Canada was officially stripped of its measles-free status by the Pan American Health Organization. It's the first time since 1998, 27 years, that Canada has been labeled as a country where measles has not been eliminated. What does it actually mean, and should we be concerned, and what does it tell us about the state of our public health agencies here in Canada? Here to help us understand all of the ins and outs is Dr. Dawn Bowdish, an immunologist at McMaster University in Hamilton, and of course, friend of the show. Doctor, thanks so much for joining us again tonight. Good to see you.
It's an absolute pleasure. Thanks for having me.
All right, Doctor, let's start with the basics. For those who aren't crystal clear on this, please remind our listeners and viewers what measles is, why it's so dangerous, and what it means for a country to have measles elimination status.
Absolutely. So measles is a virus that you get by breathing it in. But unlike other respiratory viruses like RSV or influenza or COVID that infects our lungs or airways, measles actually also infects our immune cells and kills our immune cells. So what happens is when a person gets measles and loses all these immune cells, they become incredibly vulnerable to what we call secondary bacterial infections. That could be pneumonia, it could be swelling of the brain, it could be all sorts of horrible things. And as a consequence, people who get measles end up having this period where, because their immune cells have been destroyed, they're really, really vulnerable after they get better. So they end up going back to the doctor for more antibiotics or ending up back in the hospital again. And because measles is an incredibly clever, in an evil genius kind of clever way, it can also hide out in brain cells for sometimes decades. So especially when babies get measles, they often can have this horrific, well, not often, it's thankfully fairly rare, neurologic condition where they die a decade later of these consequences. Measles also has terrible effects of pregnancy. So when we used to have measles circulating, we used to have far more lost pregnancies, stillbirths, premature babies, and babies who would be born with measles, and as we already have seen in Canada, die. So that is why, as a collective, you have never heard anyone in public health or medicine or science ever have any doubt that we need to eliminate measles. Mm-hmm. What does it mean to have the status gone? Well, I mean, it's a bit of a paperwork exercise. So does it change the day to day? But I think it's also a time for us to look in the mirror, because when you look at the other countries on that list, they're countries that have been torn apart by war or civil unrest, and they certainly aren't rich countries with good public health systems. And so to find ourselves there is humbling and just shows us how many things had to go wrong for us to get to where we are.
For sure. And I want to get into that. Just to remind everybody, we'd eradicated measles. It was out of the country. It was out of Canada, and we'd done that. And we were obviously very proud of that, right, Doctor?
Absolutely, because it meant more healthy babies, it meant safer pregnancies, and it meant that our population was someone who we weren't a place where people would be worried about coming to. Now, some countries are going to have recommendations that you should get vaccinated before you go to Canada so you don't get measles. And that's bizarre.
Yeah, is it ever? Doctor, so considering all the headlines in recent months about the spread of measles in various parts of the country, were you surprised that Canada lost its measles elimination status?
No, I mean, I wasn't surprised, because if you look at the sort of 2019, sort of pre-pandemic, there was already hints that we were getting in trouble, because historically, when measles did come to Canada, it usually came from a traveler who went to somewhere where there was measles and brought it back with them, or somebody from one of those areas came here. And those outbreaks were pretty quick to shut down, because there just weren't enough unvaccinated people for it to find someone else to infect. But in 2019, there were quite a few introductions, and it was taking a little bit longer, and there were a few more infections. And so that hinted at the fact that vaccination rates weren't what they should be. And then we had a little bit of a break because of the pandemic, and because travel was less, and we were all masking, all the other stuff that happened with the pandemic. But we knew in the pandemic that a lot of kids weren't getting up to date with their vaccines, because, they were missing family doctor's appointments because it was also crazy. So as soon as measles spread to Ontario, it got really big and spread to Alberta, I was not optimistic we would be able to shut it down with a year, and that's exactly what's happened. Mm-hmm.
Can we talk about vaccination rates first, Doctor, and get that out of the way? We know, like you said, during COVID, the vaccination rates went down. The vaccine for this is the measles, mumps, rubella vaccine that we all got as kids. And I believe at one point you have to have about 95% of people have to get it to get herd immunity, and we kind of were in that level for a lot of years. It has gone down quite a bit in the last 5 to 10 years, correct?
Exactly. And if you look at the entire country, it's down around 90%, which is not good. But where like the granularity of that data comes in, there are big pockets of people who aren't being vaccinated. So in Ontario, the big spread was in a lot of these Mennonite and religious communities where there were, percentage-wise, a very high percentage of them weren't vaccinated. And that's one of the reasons it got out of control, is because one person brings it to that community. It is the most contagious virus we know of, so it spreads within the community. But of course, people travel. And I remember looking at the Public Health Ontario list of exposures one week with absolute dread, because not only did it have more than one medical center, it had Ripley's Aquarium on it, and it had a bus to Kingston. And I thought, oh my goodness, and so sure enough, it wasn't too long before every public health unit in the province had at least one case of measles.
Yeah. Was there a moment when you're looking at that kind of data when you're thinking, how is this even possible? Because when you would have first started your career, you were in school, the idea that there would be a measles outbreak would have been almost zero, right?
Oh, I know. And, you tell stories about how they had to go travel to other parts of the world to see measles because they'd never seen one. And, it was just a textbook exercise. So, and that has changed pretty radically. And in fact, in any academic medical center, people are having, rounds to teach each other what measles looks like and how it can present to stop this from happening.
So why specifically did we lose the status? Because we hit a certain threshold of cases over a certain period of time. Is that the criteria?
Yeah. So if it circulates for a year, the concern is it's going to continue circulating. And in fact, we kind of saw a little hint about why it's important. That year sort of is an important time point. So early October, Ontario had reported no cases for 2 weeks, and everyone was doing a big sigh of relief saying, okay, we must have got it under control here in Ontario. And then I think 2 weeks after that, there were 2 cases at a church near Ottawa. And so the ones we know about are always fewer than the ones there actually are, because some of the people who got measles maybe would never seek medical attention. They'd think it was something else, or they'd have a mild case and things like that. But it's still there to infect other people. And that's probably exactly what happened in Ontario. So the reason you have to make sure you can't go over that year mark is because historically, we know that it's very, very challenging once it's so spread out over the country. And if it's taken that long to shut it down, it's probably going to take longer still.
Mm-hmm. All right, doctor, I'm going to ask you a couple more vaccination questions because I want to get these out of the way. It's the thing that everybody asks about and we get the angry emails about. But we've seen the numbers like we talked about that they're down. Is that some of that's been driven by the fact that COVID had an impact on people's vaccination, lack of family doctors, but there's also a lot of misinformation out there about vaccines. How much is that leading to what you've seen in terms of the numbers dropping?
So this is so interesting because I think, it's really, as a scientist, I always want to be data driven. So we have this thing called the Child Immunization Survey that happens every 2 or 3 years. And unfortunately, the last one is 2022. So it'll be really interesting to see what's changed since 2022. But in 2022, most parents who hadn't vaccinated their kids for measles didn't say it was because of misinformation or they had doubts or they didn't believe in vaccines. Most of the people who hadn't got them vaccinated, it was an access issue. So the family doctor crisis, we can't overstate how important that is, because childhood vaccines are something where you cannot walk into a pharmacy and get yourself sorted out. Childhood vaccines are done in family doctor practices. So when 30% of people in the country don't have a family doctor, or 30% of families don't have a family doctor, that really impacts people's ability to get vaccinated. And, I spoke to one person who, working 2 jobs, single mom working 2 jobs, and didn't have a family doctor, had arranged to get her kids vaccinated through a public health unit, but somehow there'd been a miscommunication. And she got this letter from the school saying, your kids are going to get kicked out because they're not fully vaccinated. She had gone to so much work to get them vaccinated, but hadn't realized it was a 2-dose and was sort of despondent of the fact she was going to have to take off time off work and upset the babysitting schedule and do all those things, you have to do if you don't have a family doctor, to find the public health, to get the second dose, et cetera, et cetera. So, it's so important not to lump those people into the misinformation category, because that's a great example of a family who's trying to do the right thing, but is working against all odds in this difficult economy and without a family doctor and with all these other challenges. So yes, misinformation is a problem for sure. It's hard to quantitate how big a problem is. But again, most Canadian parents, when they don't get vaccinated, it's an access issue, not a hard no, I don't deal with vaccines issue.
That's a great point. So were you going to say something?
I was just going to say, so this is as much an investment issue in public health, doctor, than anything, and a big investment's needed.
You couldn't have said that better. One of the things that public health is always, when it works, everyone wants to cut the budget because they figure nobody's sick. And, one of the critical things to do in public health is to make sure you have public health by people of a community within a community. So a lot of these religious groups and these small isolated communities that had these low vaccination rates, through budget cuts and trying to do things more efficiently and things like that, they lost some of their introduction into their public health officials. And when you, have some person swan in from Toronto who doesn't know the people and tells them to do X, Y, and Z, people are not really receptive to that message, right? And so you've got to pay the money, even if it's not the most efficient way, to have people who live in a community, especially rural communities and isolated communities. And they're not just going to talk about vaccines. They're going to talk about all the other stuff that needs to get sorted out. So I think that kind of investment is absolutely critical. We call that like the shoe leather, because, you have to walk and meet the people where they are and work in community centers and do all this kind of stuff. So that's really important. But the second investment we really need is to have people with more specialized training in vaccines. And I'll give you an example of that. Parents these days want answers to stuff they're going to give their kids, which is perfectly fair. When we were young, you went to the doctor, you did what the doctor said, you didn't question, you certainly didn't Google, and you just walked in and you did what you're told. And, I don't think it's a bad thing that people want to have more information. So here's a story from a colleague of mine who runs a vaccine hesitancy clinic. A parent had a child who was super egg allergic. And she went to her family doctor and said, can my child get the measles vaccine? I've seen it's made in eggs and they're allergic to eggs. The family doctor doesn't have an answer because, to be honest, we can't expect our family doctors to know how every single thing is made in they work with thousands of drugs. So she gets referred to my colleague who runs the vaccine hesitancy clinic, and he's able to say, yes, the measles vaccine is made in eggs, but the way that they purify it, there's never once been an egg allergy. It's safe for your child. So another example of a parent who is vaccine hesitant, but not for a bad reason, a perfectly reasonable. I mean, any parent wouldn't want to give their child a vaccine that might cause anaphylaxis due to their allergy,
Sure.
right? So we need to have nurse practitioners or doctors at these clinics, which you can get in major academic medical centers usually, but you cannot get in rural places necessarily. And so that's another investment in the training and having resources that would really help parents get the answers they need to make an informed decision.
If anything, I hope people listen just to that part of our conversation.
Absolutely.
Because you know what? I came into this and we've talked about misinformation, and that's part of the misinformation. We think that it's all misinformation, but it's not. There's people that, yes, are part of that group that are just never going to get their kids vaccinated. But a lot of it is access. We take that for granted. I'm 49. When I was 10, I could walk in my doctor's office every day. We could get a doctor's appointment open. We all had family doctors, and they did everything. My parents, I don't think were keeping track of. I mean, they had the card, but the nurse was doing it. They were keeping it. So that's very important. You mentioned that, Doctor, too. So I do appreciate that. I guess the thing for me, one of the things that still sticks out is we do see that increase in exemptions that the kids are getting from their parents, right? When they go to get this, because the schools are threatening with suspension. And you can get an exemption for a medical reason, but there's also non-medical reasons, whether it be religious or just a conscious objection to getting this. And I think I just did some Googling, as you mentioned, before we came on. I think it's some school boards reported up to 5% of kids were getting these exemptions. Is it too many, Doctor?
Yeah, it is. And, this is probably the most controversial thing I'm going to say, but we really have to close that down. So the number of people who need a medical exemption is minuscule. And the people who would need a medical exemption are probably so sick that they're not going to public schools anyhow. So that, obviously there's no question that should be allowed. And, there are none of the major religions have any problem with vaccines. So none of the faith leaders from any major religion are against vaccination. There are a few very minor religions that don't allow Western medicine or modern medicine of any description. And so for those groups, I can come to terms with the vaccine exemption because A, there's not very many of them, and B, it is a truly held deeply religious belief, and we're a pluralistic society. But that does not mean that everyone then gets an exemption based on anything. In fact, it's the opposite. If we want to protect those small minority groups, the rest of us have to step up and do our part. So Alberta and Ontario have the easiest to get conscientious objections, and we are the epicenters of so, correlation, causation, unclear, but we definitely have to lock these down and make them a lot more difficult to get because, like I said, none of the major religions have that as a core tenet or a deeply held religious belief. So I think we have to lock that down.
What I do find fascinating is if you want to get one of these exemptions, part of the protocol, if you follow it, is you have to go to your local public health agency and watch a 25-minute video that kind of educates you on vaccines. I'm wondering, do you have any scientific data or anecdotal data, Doctor, on whether people walk either saying, you know what, I'm glad I watched it. I'm going to change my mind. I'm going to get my kid vaccinated.
And, it comes back to not trying to save money and do things right. A conversation with a person. I had, I'll tell you a little story about the beginning of the pandemic. very, very beginning, vaccines were just coming out, and someone asked me to do an Instagram live, and I was so terrified because I'm old and I don't know how to do an Instagram live, and where people could sort of write in their questions and stuff like that. And one of the students in my lab had her roommate's whole family was anti-vaccine, but she asked them to tune in, and they typed in their questions and things like that, and answered the questions, things like that. And they came back to me about 6 months later and had said, "We want to thank you because my grandmother was not going to get the vaccine until she saw your thing." Mm-hmm. She got the vaccine. She ended up in the hospital with COVID during the Delta wave when things were really bad. And the doctor said she never would have survived if she hadn't been vaccinated. Wow. And, you got to answer people's specific questions and talk to people directly and show that you care and that, you're not just doing this to check off some government paperwork. You have to be an empathetic person that really, really listens if you want to change hearts and minds. Maybe those people got exemptions because they have, an idea that could easily be dispelled, but wasn't addressed in that video. We got to get the human back. You know what I mean?
Yes, yeah. Well, that's why we have conversations like this. A lot of good humans in the room, I would say. I'm hogging the microphone. I'm sorry, Doc, but I'm going to ask another question. I just want to give one chance because there are going to be obviously people who watch this and they're going to send us an email saying the MMR vaccine is not safe. What do you say to people who have any doubt that this is not a safe vaccine?
So we have got so much data on this. I mean, there have been, even in Canada, we've had this vaccine in almost the exact same form since 1969. We've had, so much use of it. Are there extremely rare things that can go wrong with vaccines? Yes. Although the MMR one is one of the safest ones we have. But any of those things that can go wrong with vaccines are much more likely to go wrong with the infection. Much, much more likely infection. And measles has the biggest differential between rare side effects and possible long-term serious health issues of any of our infections out there. So any myth you've heard about associations with autism or anything else have been debunked so incredibly thoroughly that and again, we have post-monitoring. We're after vaccines. We have a monitoring system for looking at them. I mean, we really, truly do look for things that could go wrong and address those things. And this has just been such a workhorse of the vaccine schedule, not just in Canada, around the world, that, there just isn't data to support that concern.
Doctor, let's talk about the immunization registry. Are we any closer?
It's interesting. Some of the provinces are getting their act together and saying, we did this for COVID. And wasn't that convenient? When you could just go type in your health card number and look it up. Where Canada's the outlier from our sort of comparator countries in the G7 and the G20, most countries do things at the national level. And the way we do healthcare and public health in Canada, the provinces administer it. And we have super strict privacy laws, like some of the strictest privacy and personal information laws in the world, which overall, is a good thing. But it means that sharing between the federal level and the provincial level can be a little bit complicated. My colleagues and I have always been advocating for a national registry because, of course, we change provinces. Mm-hmm. And it's really hard to get your medical records switched between provinces. It's also really difficult. Like newcomers to Canada sometimes would enter like a federal healthcare before they get their provincial healthcare. So there's another miscommunication. And in fact, there were some schools in Montreal and other places that people thought the vaccination rates were like problematically low, but it just turned out there were a lot of newcomers to Canada who hadn't got officially sort of registered in our public health systems. Mm-hmm. So there's so many good reasons to bring this to a national level. I'm glad the provinces are stepping up. Ontario really, come on guys, we can do this. Get it going. But we need like someone who's going to champion this as like their big contribution to Canada at the federal level. And we need the timing is hard when you think about all the things we're dealing with sort of right now. But
Doctor, here's the big question of the interview. How long could it take Canada to get back its measles elimination status?
So we need a good year of no measles circulating. And it's nice that the rates are going down. But, historically, measles used to come in 7 to 12-year waves. And the reason it came in those 7 to 12-year waves is because every baby born is vulnerable to measles. And so if you don't have vaccines, after a critical amount of time, you build up a number of vulnerable people, including those really young babies. So I sincerely hope that we'll get this current one under control within a year, and we'll be able to reapply and see if we can get our status back. But I worry that we're going to have these flare-ups unless we deal with some of these systemic issues that we've just talked about.
I'll take the last question, Doctor, if that's okay. What's your message to public health workers across the country who are probably feeling down, frustrated by this announcement? It's not the kind of publicity they're looking for in the middle of all the hard work they're doing.
Well, I see you, I appreciate you, and you couldn't have worked harder to do what you do, but these are systems problems, not people problems. And I don't like blaming people for bigger problems. So none of us individually can fix the family doctor crisis or the national vaccine registry. None of us can do this, but all of your listeners have the power to talk to their politicians, right? Mm-hmm. Because they are our government and they should do what we want. And what we want is a safer future for Canadian children. So we want to get our vaccine rates higher, and we can do this if we keep that pressure up.
All right. Anything that we didn't cover tonight, Doctor, that we should have?
The last thing I just want to make a case for is there are, in sort of like the late 90s, early 2000s, there was this big measles vaccine autism scare, and there was a blip in vaccination rates. And we know that there's about like maybe as many as 12% of Canadian kids born then didn't get vaccinated. Now, the reason I want to bring this up is because those are people who are entering their baby having years now, right? And so many of them may be entering a pregnancy or thinking about getting pregnant and not being aware that they're not protected from measles. This is so critical because, as we discussed, measles can lead to lost pregnancies and stillbirths and babies who are born and will never reach their full intellectual potential because their brain couldn't grow and develop properly. If you're thinking about having a family, make sure you see if you've got your vaccines, and if you are unsure or can't prove that you got vaccinated, no harm, no foul if you get another one, and do that before you get pregnant, because we don't give these vaccines to pregnant people because they're a virus. They're made of a live virus. So that is my one plea to people. And another thing we may have to change systemically is starting to check if people have measles, mumps, rubella immunity before they get pregnant, in order to help people, be safe, have safe pregnancies. So that is the one thing that I'm trying to share with people, because, I didn't, if you'd asked me when I was a 20-something, did my parents get me vaccinated as a kid? I might not have been able to figure that out. So I think it's really important that young people know that status before they start a family.
It's great advice.
All right. Always great to have smart, intelligent people on the program. And certainly Dr. Dawn Bowdish falls into that category, immunologist at McMaster University. Doctor, always good to see you. We appreciate your time.
Thank you so much. Take care.
Well, cue the emails.
Yeah, let's hope we get some. What's our email address again? Closer look.
Closer look at villagemedia.ca.
Yeah, well, I always say this, and I'm waiting. Derek could put a clip together of me saying this after every other show, but this has been in the headlines for couple days.
Big news.
Big news. It's all over the media. We have a chance to speak to one of the leading experts who really understands this issue and can explain it to the layperson in a way that Dr. Bowdish really can.
Right.
So we have these great conversations and open my eyes to a couple things. I can get angry at the people who are spreading just total lies about vaccines, and think that the fact that the numbers are down is all because of them. Well, it's not all. There might be a pocket of those people, but it's also just, as she said, there's a lot of families struggling to they don't have a doctor.
Right.
They might not be able to get to a clinic. There's not enough vaccine clinics at public health. So they're not able to get their vaccines, even though they want to get their vaccines.
Yes.
So it's not just the anti-vaxxers. It's that idea too.
Right. And you've got a healthcare system that's fractured, right? Mm-hmm. And we talk about this before. You've got, the school boards, local school boards through the Ministry of Ed saying kids got to be vaccinated. And you've got a fractured healthcare system that can't support what the Ministry of Ed needs.
Yeah.
Right.
Yeah.
So the whole thing is a mess.
I think a great documentary would be if you could convince a public health unit to let you spend a month talking to every family that came in to get the exemption and then had to sit and watch the government 25-minute video, which is actually pretty good. We'll put a link to it on the site.
Yeah.
But just explaining the facts of this vaccine, right? I wonder, it'd be amazing to poll how many parents would walk out of that video room saying, you know what, I've changed my mind, or I'm even more hardened that I'm not going to get the vaccine. Be a great documentary.
Be a good social experiment.
We should do it as like a what do they call it? An offshoot of Closer Look.
Let's do it.
What do they call when someone does another show?
Spin-off.
Spin-off.
Yes.
That's right.
Spin-off to Closer Look.
Closer Look. look into local public health units. But that was a great conversation, and thank you to Dr. Bowdish. I emailed her this morning, and right away she said she would be delighted to come back and chat. So we've obviously going to keep her in our Rolodex. Absolutely. She's one of the good ones. Okay, again, it's a closer look at villagemedia.ca, closerlookpodcast.ca. That's our website. Check it out. And thanks for your time, as always, tonight. This evening show produced by Derek Turner, as always, for Michael Friscolanti. I'm Scott Sexsmith. Thanks for watching. We'll see you tomorrow night at 7, right here on Closer Look.
Frisco and Scott's Wardrobe provided in part by Moores, Sault Ste. Marie.